Well, good morning, everybody. We're not completely sure how many people are out there, but we think there's around about 50 of you. And we know from some of the earlier conversations, at least one of you is still wearing their pajamas. I think we've got a good mix, as I understand it. We've got some Golden Key partners. We've got Golden Key, you might call them friends from around the city. We've got people from sister projects funded by the National Lottery working with the same client group. And we've got a wide group of interested people. So welcome, and I really hope you enjoy the next hour. So I'm John Simpson, as you can see there on the picture. I'm the independent chair of the Golden Key Partnership. And for those of you who aren't sure, Golden Key is focused on improving services for people with complex needs in Bristol through both direct service delivery and through promoting system change that's designed to improve services for that same group. And this is the first of a series of webinars we're intending to share with people, where we share what we've learned about, especially about system change. And this one, as you will know, focuses on learning from working with people with complex needs during the challenging times that COVID has presented us with. So since the COVID arrived in March, obviously across the city, all the services have been struggling to respond to those challenging times. And so through the Golden Key Partnership, which involves around about 20 organisations in the city, both public and voluntary, we've wanted to try and make sure we learn from the experience of delivering services in these kind of challenging times, so it strengthens us for the future. So we held a meeting of the partnership kind of in the early summer, where we brought the partnership together and shared our learning about working in this environment, and produced a draft manifesto which said, well, these are the things we've learned from this that we'd really like to embed in the system to make sure it's even stronger in the future. So it's that learning that we want to share today. So we've just got some very simple, if you like, house rules. You should be able to see in the top here, we're recording this session. We hope everybody's okay about that. We could use the chat box to ask questions during the event, and there'll be an opportunity at the end of the event for those questions to be responded to. And if we haven't got time to do that with all of them, we'll endeavour to follow up with some kind of written Q&A. And those questions will go to the panel at the end. So I'd like to introduce the panel for today. So I'll be kind of the questioner and chairing it, and we've got, as you can see here, we've got Maggie Telfer and Anna Smith. So I'd just like to say a little bit about Maggie and Anna by way of introduction. As the chair of the partnership, I'm really thrilled that Maggie and Anna are key members of our partnership. Maggie is the CEO of BDP, and in 2018, Maggie was judged to be one of the top 100 women in the West. And I looked at that citation, Maggie, and it said, this was because of your inspiring and dedicated work, building and shaping the alcohol and drug services that support thousands of people in Bristol. And I know that's been a lifetime project for you, Maggie. And I was really pleased to see it recognised in that way. And Anna, CEO of One to One. Again, Anna's work was celebrated on International Women's Day a year ago, where she was described as one of 4 amazing women. And again, the citation said, one of those impressive people born to be a leader. Wow, that's pretty good, Anna. And for many years, Anna, in her role as CEO of One to One, has been leading services focused particularly on women, especially those involved in the sex industry on the street, and those who have had their children removed from them. So both Maggie and Anna are working with people with complex needs, living challenging lives, and this is an opportunity to share some of their learning from working with that group through COVID. So the sequence of events is I'm going to invite Maggie first of all to do a presentation, maybe 10-15 minutes ish, that kind of time, and then Anna to do the same. And then I'll ask them a series of questions, some of which will go to both of them and some will just go to one of them. And then we'll end up with an open session responding to the questions you put in the chat box. And we'll finish on time, I assure you. So Maggie, would you like to start us off?
I will, yes. Just get my slides up. It's where the magic works. Okay, so very quick few words about BDP. We've been around for around 35 years. We're in the business of reducing harm and helping people to achieve independence from alcohol and other drugs, and particularly to maximise their potential. And we provide a whole range of services to achieve that. So everything through from street outreach, some of which we do in partnership with Anna's 125, a needle and syringe programme, which is one of the first kind of pilots in the UK in the days of HIV and AIDS. We've got one of the largest primary care based shared care opioid substitution treatment programmes actually in the UK, with around 1,900 individuals today getting their treatment, reaching their communities through that. And we have a range of targeted support for diverse communities, people with learning disabilities and mental ill health, and a service called PRISM for people who are LGBT+. Okay, next slide, please. Okay, so 23rd of March 2020, which also happens to be my birthday as well as the beginning of lockdown, anyone to note. Okay, so on that day we were supporting 2003 adults and 220 children and young people. Lockdown for us meant reduced footfall in lots of our services. So we have a central Bristol base, and we quite often on an average see 50 or 60 people come through our pink door. Clearly that stopped happening in that way in lockdown. And also our OST service, so supporting people dependent on heroin in partnership with the GPs around methadone or buprenorphine. We deliver that 42 GP practices. Any of us who were trying to talk to our GPs in that time will know that GP practices were very locked down. So again, our ability to be in contact with people we support significantly reduced. So what did we do? Well, we started delivering services differently. We did stay open all the way through, and we also delivered some new services. Next slide, please. Okay. So things we did delivering differently, our opioid substitution treatment, again, prior to lockdown, we'd done individual risk assessments with 1,900 people in treatment to look at how we could make changes, particularly to people whose medication was supervised daily in a pharmacy. That was a national move to reduce to allow people to socially distance and to self-isolate. But that was a mammoth task done in just a couple of weeks. And clearly with a lot of potential risk in there of moving people who perhaps were picking up medication daily at a pharmacy to perhaps doing that weekly, or for many people less frequently. We did move some services to telephone and Zoom. We have also creative communities. We have a orchestra, a choir and a drama group. They moved reasonably well online. But the unseemly rush to putting everything on Zoom and other digital platforms just doesn't work for lots of the people we support. Lots of the people we support actually don't even have a phone from week to week, let alone a smartphone, let alone money to buy data, let alone a comfy back bedroom on which to have Zoom conversations. So digital access is a real problem for the people we support, and that's going to carry on being a problem going forward. So I'm concerned about the rush to, you know, digital is the answer to all our problems, because it clearly isn't the most marginalised people in our communities. A needle and syringe programme, we did a modest amount of home delivery prior to lockdown. We increased that substantially. So socially distanced home delivery people. And we massively expanded our street outreach. So we didn't have people coming in through our pink door. We were actually out on the street and right across the city finding people, and particularly finding people on our, we had a vulnerable clients list. So going to actually find people and check out that they were okay. We also worked with the 5 hotels in Bristol that were part of Everyone In, as we moved hundreds of people in Bristol from street and very poor housing into hotels. And one of the things we did was deliver our bloodborne virus testing in a different way. Clearly, if you're doing bloodborne virus testing, it involves sort of, you know, dry blood spot testing, finger pricking, putting blood onto a card and so on. That became incredibly difficult to offer. But we've got in Bristol more than half of people who inject drugs who are hepatitis C positive. It's really important that we are testing people and linking them with treatment. We can't just put everything on hold for what we all probably thought initially was going to be a few months, and what we all know is, you know, here for quite the medium, if not the longer term. So we introduced self-testing, and done through sending people kits, put together a little YouTube demo so that people can see how to do it, and then the tests go off and the results come back to us. So that was different, and you can see Jess and Phil there with our mobile harm reduction truck offering that. And next slide, please. And then we did some new things as well as doing things differently with some system flex and partnerships. So opioid substitution treatment medications, for people self-isolating, we did socially distanced home deliveries. We've got a team of about probably 20 people, including other drug and alcohol service partners, and we did 274 of those in the first few weeks, and that's something we're continuing. New Leaf, what an awful time to develop a new project. This is funded charitably. It went live about 2 weeks before lockdown, and this is working with young people whose cannabis use is problematic and who are linked on the edges of county lines and child and criminal exploitation. So it's very targeted bit of work. Real challenge, how do you get your first young people in contact with that? We use some of our contingency management resources to reward young people who would engage with us with a pizza delivery, for instance, a way of getting young people, you know, to come out of their homes and actually talk to us virtually. Other things we do, we have a big presence normally in nighttime economy, so we'd be at, you know, a Bristol Super Club, Motion, a couple of times a month, and we would have done all the big festivals. So we would have done Pride, Love Saves the Day, Carnival, Tokyo World, you name it. Obviously the nighttime economy went, and the nighttime economy is not coming back anytime soon. Could be a long time before any of us are in a field listening to music with a large number of people. So we launched a new blog called The Drop, and that's been really important in helping us develop a accelerate a partnership we have with the University of Bristol and the Students' Union. And that's just moved very recently into us launching a harm reduction service for students around reagent testing, which allows some drug checking, and that went live last week. One of the really interesting things we were able to do was, because our NHS inpatient detox provision and our community detox provision weren't able to operate, we did some alcohol detoxes using alcohol. Usual medically assisted routes not available, certainly people at serious risk going into withdrawal, and then that developed into a number of people using alcohol on a daily basis on a reducing way, provided by us, because of course money's dried up for alcohol, and there are some really good outcomes from that small group of people. So we're looking at, does that have a place going forward? Is it a new kind of choice and option for people? And we also did something that is definitely not in our kind of objectives, which is we designed and got delivered over 1,500 activity packs. It was very clear, being on calls around everyone in, that there was a gap in terms of people being very bored and not feeling like they could self-isolate. You know, people were swept off the streets into hotels, and that's it. No one else was we checked no one else was planning this, and we designed and delivered activity packs, which certainly feedback in the early weeks was that was really important for some people, to have some things to do and focus on and distract from their kind of situation. The quote comes from some research we also supported during lockdown with the University of Bristol. This was looking at the impact of Covid-19 and lockdown on people who inject drugs. And basically we were finding participants and then connecting them with phone interviews with the researchers, and Lucid's now been published. And then finally, final slide, please. Okay. Our wonderful staff and volunteers. I think we all know, if we kind of manage staff, that it's just a roller coaster, you know, and last week when we were looking at, you know, the current month's lockdown, again, you know, another peak in that kind of roller coaster. I think what we've all become more used to and depressed about, but used to, is that this wasn't going to be something around for a few months. This is long term. And that, you know, most people are anxious some of the time, and that's going to continue. We have very well established reflective practice, and that's kind of been really important all the way through this. But I think the key things are quite simple, really, which is listening to people, supporting individuals, and really importantly, containing anxiety. Anxiety can be contagious. You have one person who is feeling very wobbly, and suddenly you've got a whole team that is wobbling, and that can really, you know, begin to undermine what we're all here for, really, which is supporting people who have problems with alcohol and other drugs, many of whom are living in very poor accommodation, and are really a very marginalised and stigmatised group. And down here is our fabulous engagement team. And this was our way of marking pride, given that we weren't able to be out and about at festival. So it's a quick run through, hopefully, about things we continue to do but did differently, some new and very different things we did, and you know, our kind of real thank you to our team who have worked all the way through this, to keep in touch with people we support. Thank you.
Thank you very much indeed, Maggie. So we're going to switch over directly now to Anna. Over to you, Anna.
Morning, everyone. Can everybody see the slides? Great. Okay. Thank you, Maggie. As a lot of what you said has resonated, and thank you for asking me to speak this morning. It's a pleasure. Like Maggie, I'm going to start by outlining a little bit about 125 so that you understand the context of how we responded to COVID. Some of you may know our work well, others may not. I won't spend too long on that bit. So 125 works with women who street sex work and has done for 25 years. About 4 years ago, we added Pause Bristol to our programme of work, which works with women who've had 2 children permanently removed into care. And 2 years ago, we set up Peony, which works with women who are moving on from those experiences, and we've opened that up to Bristol-wide women who are vulnerable. So we work across the city with women who are vulnerable, and we changed our strapline recently to represent that, so for women to heal and thrive. At any one time, our women could be experiencing poverty, street homelessness or very inappropriate housing, domestic and sexual violence and abuse. They might be in addiction. We work very closely with BDP and they go out on our van once a week at night. Mental health issues. And just before lockdown, we had a conversation with doctors who work with people with complex needs in Bristol. And the doctor who'd run our clinic the week before, which is running our drop-in, said, all of your women will be classified as vulnerable to this virus, which was a real shot across the bows, and then we went into lockdown. So you can see from the work that we're doing that you know, it was very much needed, and you know, that we felt very much that we had to continue with our work. Sorry, I just clicked on too far. So just from the right hand side of that second slide, that shows the breadth of our work. Those are the things we're aiming towards achieving with our work, and I felt like that would just stop and go backwards massively if we didn't remain open in some shape or form. So I've been asked to speak in this particular presentation in relation to the manifesto about strong moral purpose and committing resources and creating urgency to a small number of shared priorities. So in relation to that, I'll talk about our values. Sorry, I keep looking too far forward. Sorry. So Golden Key comes to Bristol, which is an amazing place to work because people do share values and do put the person at the centre of their services, and these are values that 125 also holds. So those are our values, and I felt particularly in relation to unconditional love and willingness to see things through, that we really had no choice but to continue working with the women. It would make a mockery of what we did if we did that. So like Maggie, we stayed open, but we closed our actual group work and services and one-to-one work for obvious reasons during lockdown. We convened food drops to women, essential items to women, which would be like washing powder, sanitary towels, toilet roll, which we all were fighting for at the time. We tried to be as creative as possible and think about what we could do as opposed to what we couldn't do. So we also offered one-to-one telephone support. We did Zoom groups for yoga and some of the activities that we do. And as we unlocked, we started to do socially distanced walks. We brought women back into our drop-in on a socially distanced basis and convened our group work again. I think also what's worth saying is that in order to do this and have a shared purpose across Bristol, we had to have also already developed partnership work with other organisations, informally and formally, and develop trust and strategic work. And I'll talk a little bit about those 3 things. So we could not do what we do in Bristol without the support of the police, BDP, and the NHS and the complex needs doctors and housing. And that works because they understand the needs of our women, because we've spent time developing those relationships. At the time of a crisis, you obviously can't suddenly do that and say, oh, come and see our work and have a tour. And that had to be there already. And that trust had to be there, that they understood us and we understood what they could do. So some things that happened included housing making direct referrals for our women, and just an understanding of our services and our organisations responding to that very quickly. And Maggie and other people in Golden Key and across Bristol are involved in strategic groups which work to identify gaps in services for the people that we work with and look at the citywide picture. And some of those groups convened very quickly during the crisis, and I'll talk about that a little bit more just as I move on. The other thing I was asked to talk about was co-production. So in relation to those relationships and those partnerships, some of the things that happened was an emergency domestic abuse response group was convened by the mayor. And one simple thing that came out of that, as Maggie mentioned, is that our women didn't have phones, they didn't have access to the internet. So they gave us funding for extra phones during that time. But we also had conversations about the massive increase in domestic abuse and where women could be going. And I very much hope those conversations will continue, and that group is going to stay convened and look at some of the gaps in services in domestic abuse across Bristol. I mentioned housing and their response. Obviously there was the move into hotels, but there was also a relaxing of those barriers that people have to jump through to get housed because of the emergency, which we really appreciated. The Lord Lieutenant convened a group of vulnerable organisations working with vulnerable people, ourselves, Unseen, Beloved, and she felt that it was really useful, she's called Peaches Golding, to then put those issues, which were very profound during lockdown particularly, to a commissioner. So we had a meeting about 5 weeks ago with a mental health needs commissioner, and I hope that conversation will continue, because what COVID has done is flagged issues that I think we all know were already there and need to be responded to in the long term as well. Unity Sexual Health remained open, which was absolutely vital for the women needing contraception, because the whole purpose of pause is to prevent birth and removal. The scripting service continued, which was again absolutely vital. So women would drop to our drop-in and continue to get a script. If they didn't get a script, they would have ended up having to sex work more or take drugs that were, street drugs were particularly dangerous around that time. So those are the kind of things that were coming out of the co-production, these sort of informal relationships that we had. But also Fair Share, who offer food around Bristol, were incredible. Phenomenal was the word that the person at Polly who works at 125 said about them. They produced much more food for us. Through understanding our needs, they did things like producing UHT milk for us, because they knew that women didn't have fridges, and they helped us to convene the food drops that we were doing. And Booker, which is a food outlet, gave us care home status, so that we were able to book slots for deliveries of food, because we couldn't get slots through the normal supermarket avenues. Across 125, we also co-produced. The staff team came together, and instead of it being programmes of work, which can be a little siloed sometimes, everyone just came together and did food drops and packed food up and put notices in, notes into food bags and contacted women if they were working that day. So that it brought us together in some ways. But that also brings me on to staff wellbeing, which is the last thing I'm going to speak about. And Maggie has touched on some of those issues too. This has been an incredibly difficult time to lead and really difficult to make decisions. I had a sleepless night the night that Boris locked us all down. At worst, I felt that if we didn't stay open, the women might die, and if we did stay open, the staff might die. We know much more about COVID now, and we've got processes in place, but across my staff team, we had responses like people crying in my office saying, please can I work full time because I can't be at home, to people saying, why are we in? I don't want to be here, this is dangerous, and it's irresponsible to be in the building. So all of those responses are understandable, but never before have we had to deal with people's emotional and physical vulnerabilities at work in the way that we've had to. In my 11 years of being a CEO and years of being in the sector, I've never had to deal with anything like this, and none of us have we? So it's been really difficult. And people who we did send home, so our fundraising and comms team, for example, found it incredibly hard to come back into the office because it felt like everything they were touching was going to give them COVID, whereas the rest of us were more used to being in the building. And those who were working at home, some of whom had said they should be from before lockdown, were saying, well, I'm safeguarding from my bedroom. The last conversation I had in my bedroom was with somebody I'm incredibly worried about. So a real challenge for all of the managers in the building, and particularly myself. So what we did was, as well as all the things that we already do, which include reflective practice, etc., is I sent out a weekly newsletter to the staff team. And ordinarily these things are very dull, nobody reads them, but they were meant to be to just keep everybody in touch with what everyone was doing, and quotes from the women and things that we would normally hear and see anyway. I sent out lots of CEO-wide emails, which I don't normally enjoy doing, but I felt people needed to get key information all at once. I sent around a daily joke. You'll remember what was going around during lockdown, all those memes and things. I sent some of those out to the staff team to keep the spirits up. We had weekly all managers meetings as opposed to sort of every 2 or 3 weeks. We gave people time to talk, as Maggie said, about their concerns, to try and get to the root of them. And some people were shielding partners, and there were real issues going on. We did a survey of staff after the first lockdown in terms of how we respond to wellbeing, and from that we decided to have a wellbeing policy. We didn't have a wellbeing policy before. Lots of the things we're doing were good practice, but we hadn't convened them in one place, and there were other things that we hadn't thought of that we could add. So we're now appointing mental health champions in the organisation. So we interviewed for those last week. It's not perfect. I've had a difficult week this week again with the second lockdown yesterday. There were some people who were in a state of quite high anxiety, but it's a balance and we're doing what we can. I'm very proud of what we've done in our response to COVID, and I'm proud of what people right across Bristol have done in bringing down the barriers for the service users and putting them at the heart. And I think they would have been in a lot more danger if they hadn't had that response, but it's been a challenge. Just to end with a couple of quotes, because I think these are the kind of things that keep us all going, don't they? Those things that service users say when they're on the mend, in recovery, moving on, or unable to have the space to think about what we've done, really keep us all going and help us all work together, I hope. And that's what I wanted to say.
John, sorry, you're muted.
I just wanted to highlight 4 things that came from those for me. The first thing was just how profound the challenge was for both the staff and the service users and the leaders, I guess. The impressiveness of the response and how thoughtful those responses were. I think that was really deeply impressive for me. The depth of the learning and reflection which has taken place as a result of that experience. And, you know, Anna, towards the end there, talked about how proud she was. And I think that we ought to collectively be proud about how people have worked together through this time. So thank you both. And I'd encourage participants now to put any questions they want in the chat box. I'm going to just start off with just asking some general questions to Maggie and Anna to try and draw out some of the themes and almost to kind of make recommendations maybe to the system, which maybe go beyond individual organisations. And I thought I might group that under those 3 headings of working with clients, supporting staff, and then working in partnership. So I'm just running out, and maybe Maggie, I could ask you to start with my first one, which is, so you talk about how you did things in new ways and different ways. So what are your sort of top 2 or 3 things that you think you've learned from this, which have got application more broadly across our system in terms of working with clients in new ways or different ways?
I think probably the key learning for the system is that housing is the foundation for probably most of the things that we do to be able to support people. You know, if I've got nowhere to live, am I thinking about, am I going to go to meet my counsellor or various appointments? No, I'm not. I'm thinking about, where am I going to sleep tonight? Is it going to be really cold? Oh, it's pouring again. Am I going to be safe? Particularly if I'm a woman, am I going to be safe if I sleep here? So I think, you know, those housing first principles that were really expanded en masse through everyone in, I think are really important that we take forward as a system, because it is the platform on which we build everything else. I think there are still a lot of challenges, and we're nowhere near back to normal activities. We're doing we're talking to 100 people is our target at the moment, about their people who are using needle exchange in pharmacies who are not. October 20, pharmacy needle exchange is operating at 30% of its activity compared to October 2019. Big questions, what happened to people? We know from some feedback that some people have reduced or stopped injecting, particularly people who were in treatment. So it offered them a kind of opportunity to make some changes, but we don't have a good enough picture of what's happened out there. And with the levels of particularly hepatitis C action we have in our city, we really need to understand what's happening so we can respond to it. Otherwise, we have, an epidemic of hepatitis C coming towards us, and at the bottom level, that kills lots of people.
Okay, thank you, Maggie. So Anna, what would be your take on messages to the system about new ways of working with clients?
I think that some of what we've learned in the last few months we should really hold on to. So and some of what we've learned is not there, we need to address. So looking at domestic abuse, for example, there are no refuge spaces for women with complex needs because they can't cope with them, and we need to address that. And there are other gaps in the system, and also that if housing can flex like that, which was amazing, then let's do it again. Let's find ways of doing that again, and stopping those barriers to people going through. I think in terms of good practice, I agree with Maggie that Zoom is a very limited medium, and what we do we cannot do by Zoom. We absolutely have to be face to face to be doing trust building, giving food, giving warmth, and all the things that are at the heart of our service.
Right.
Actually, we've learned a little bit that we could be doing some Zoom pre-engagement groups with people who are not yet ready to walk in the door. There might be ways of reaching them in that way. And I think it highlighted for us that we need to do more outreach. We're not funded to do a lot of outreach except on our van, and actually there's a gap between getting onto our van, grabbing some clean needles and a pair of knickers and coming into our drop-in. And we need to be filling in that gap with some assertive outreach if we can. So we're looking at trying to fund that. But also, look at what we can do in Bristol when we want to, and let's hang on to that.
Okay, thank you. So, I mean, both of you as well have described some of the issues that staff faced during this time. You've illustrated that, I think, very graphically. So again, what would be your message to the system about what the carryover from that is into supporting staff in these challenging roles, permanently? Maggie, have you any thoughts on that?
I think it's just carrying on doing the simple things. It's listening, and it is supporting individuals, and it is containing anxiety. And like Anna said, last week again we had a mini sort of outbreak again of anxiety, and it's about taking stock of people's concerns and then looking at the bottom line how we kind of carry on delivering services, because that's what we're here for. We need healthy, supported, creative, brilliant staff to deliver services to people we support, and we mustn't ever lose sight of why we exist as organisations. I think in normal times organisations, some organisations can go to a place where you have to ask who are they for. They've lost their kind of focus on their service users, and we're not in normal times, and we must keep our focus on the people who we were created to support.
I know you got a take on that.
Totally agree, and that's kind of what we say to ourselves is what's best for the women. I think a combination of what Maggie said, yes, giving people time to talk, giving clear information, which I'm not sure the leaders of our country have always done at times. So really simple rationales for what's going on and why we're doing what we're doing, and keeping on sending that information out at a time of enormous change. And a bit of tough stuff for myself and for others. I mean, I can't please 40 people. I can't do what 40 people want me to do, and there are going to be people that aren't happy with that, and I've got to hold that somehow. And people are going to have to do things that they're not entirely comfortable with, and it's a journey. So some of the people that were saying to me, why are we in the building, are now very happy to be in the building, and the other way round. Some people are a bit more anxious. So like I said, sort of giving them a space to speak through mental health champions is one way of doing it, but just also, you know, this is it, and we're lucky we're not being furloughed or made redundant, and just try and hang on to the reason we're here.
Yeah. Okay. Thank you. So just moving on to thinking about, you know, again, both of you have talked about working across organisational boundaries, and I just wonder if you have any thoughts on why, or if and why, that has worked better during a time of crisis, and how we can actually build on that kind of cross-organisation working in the future. Any thoughts on that? Have you found any, using your new and different ways, ideas, have people worked together in new and different ways, or is it the agency of the response that has made people work in different ways?
I think they have. I think, you know, nationally it would be hard not to know, for example, sorry to mention this again, but that domestic abuse has been a huge issue for people during lockdown. It's you know, the spotlight's been on it, but I think also on homelessness and its associated issues. You know, and the fact that those people might die if they weren't helped has galvanized people's support, and they might die anyway. I mean, that's the fact of it is, as Maggie just said about Hep C, you know, our women might die anyway if we don't support them. So we need to use that energy to move forward. And I think some of the things I said in my presentation about, you know, suddenly we're in front of commissioners through a group that's been convened as an emergency response, and that needs to be happening anyway. So we need to hold on to some of that understanding and make the best of it.
Maggie, any thoughts?
I think that, I'm not sure whether it'll translate into longer term change or not, but we kind of operate in one of the most kind of monitored fields in the world. You know, we collect an enormous amount of data. It goes into a national system. We've got masses and masses of centrally set outcomes, and those mean there's often very little flex to be able to do something a bit different, because we'll get chopped off at the knees if we're not doing X, Y, and Z. I would hope we get some momentum to look at, you know, are these the right outcomes? Should we have these centrally identified ones, or should we be able to have, you know, flex those locally? And I guess that's a key issue sort of for commissioners, and certainly commissioners in other parts of the country have moved further down that kind of route, really.
Yes, and that mirrors in a sense the debate about responding to COVID, whether that should be local or nationally driven, I guess. Thinking about the equality, diversity and inclusion issues that have emerged for both of you. I mean, obviously one you've both talked about is around digital exclusion, which may have come into sharper focus. So have you, again, any observations about how the COVID crisis has shone a kind of, if you like, a new light on some of the EDI issues facing our clients? Any view on that?
Well, I think digital access is, or lack of, is a key issue. I know that Bristol City Council has a group of people looking at digital access, but as far as I'm aware, it's kind of very high level, sort of long-term look. But meanwhile, we have people who, you know, don't even have a phone from week to week, let alone a smartphone. And I think it's incumbent on all of us as organisations to make sure that we are seeing people face to face in a socially distanced way. We are using PPE if we can't be socially distanced. We can't, you know, how long is it okay just to have telephone contact with somebody? You know, 6 months, 9 months, a year, you know, and one of the things that our staff have found, particularly when they've had, you know, only telephone contact with somebody for, you know, maybe 6 months, and then they actually see people again, that whereas people have been saying, yes, you know, I'm fine, it's all good. Actually, when you see people, you realise that it wasn't fine or good, and just how isolated and marginalised and desperate people have felt. Some people, it's been a good experience, but there's an awful lot of people out there who have had a really desperate experience and not been able to talk about it.
Anna, have you got a take on that?
Yeah, and I agree with Maggie entirely, but on top of that, poverty, that people just don't necessarily think about day to day if they're not seeing that. BAME, so not only because the higher risk of COVID, but also we have communities in East Bristol that we feel we're not reaching well enough, and that's been highlighted through some of the domestic homicides in Bristol as well. And poor health, so mental health and physical health, but probably particularly mental health, and that being addressed in conjunction with maybe drug use or something else that's going on, and just not getting that support that they need, because, you know, like housing, if you're in poor mental health, you can't engage.
Yeah, I think for us, just on the Black, Asian, minority ethnic populations, we the alcohol detoxes using alcohol that I talked about in my presentation, we particularly picked up Polish people who are alcohol dependent through that, who don't necessarily come through more mainstream alcohol detox opportunities. So that's again interesting, and something that we look at how we might build on that.
It occurs to me, as a Golden Key partnership, we should try and capture some of this EDI knowledge that we've learnt from this more systematically, and also maybe just reflect on what the partnership can do to address digital poverty. I'm just going to I'm looking at some of the questions that are coming in through the chat, and there's an interesting one here, I think, from Karen Biggs. I don't know who you are, Karen, but you're very welcome today. It's a great question. So what Karen's really exploring is, are there any new needs that are emerging as a result of COVID? You know, what is the experience of COVID producing a whole new set of needs that we might need to think about, which almost potentially weren't there before COVID? So has the experience for our clients of living through COVID mean that there are some new needs to respond to?
The one that springs to mind is mental health. It's not a new need, but much more profound and re-traumatized through experiences of lockdown and poverty as well. I think that needs to be acknowledged. I just by coincidence had some work done on my shoulder yesterday, and the guy who was helping me said that he saw a train driver who has seen more suicides in the last 6 months than he would see, you know, in a much longer period, and that's not necessarily of our community. So those things are far more profound in the communities that we're working in, and I think we'll see that if we don't address that now, we'll see it, you know, coming to fruition in the worst possible way in the next few months as well.
I think we've got, because we also work with children and young people, and I think we've definitely got a generation of children who have been unseen, who, you know, struggle in their families, but at least if they're going to school, some of the time somebody has eyes on them, and we have had a very long period of time when nobody has had eyes on those children, and then, you know, particularly children who are, you know, just worried about exams, looking at, you know, our economic situation going forward, are not going to have the opportunities that they would have thought they'd have, you know, sort of 9 months ago. So I think there's a generational issue that we need to watch. And from my world, we know that when we've had periods of, you know, lots of exclusion from school, lots of, you know, really long-term unemployment, that's where our heroin epidemics and outbreaks have emerged from, as a kind of, you know, easy initial solution to a whole range of kind of trauma and sort of nihilism, really, people feeling really hopeless.
It's an interesting point about children and young people. I mean, I'm sure everybody will have been aware of the headlines from the Ofsted report this week about the impact of COVID on school-age children and young people. which is very, very significant. So this idea of new needs is actually something that we really maybe need to do a lot more thinking about, to really understand those by group and by age, and to establish what they are. And there's an interesting contribution here on the chat from June Clark, talking about the multiple effect on vulnerable clients of all services stopping face-to-face delivery. So of course, it's not just the individual services that were stopping doing that. From the client's perspective, everybody was stopping doing that.
Yeah.
And
I think,
go on, Maggie.
Sorry, John, I just think, just to echo Anna's point earlier on, I think the fact that that was really important in terms of not stopping face-to-face, because it's perfectly possible to see people face-to-face, have socially distanced contact. We did lots of socially distanced home visiting and walks and all the things Anna's talked about. And if you can't do that, then that's what PPE exists for. And, again, and I said, we should feel really proud in Bristol. I think, feel really proud despite all the difficulties that actually we maintained that face-to-face contact, because lots of organisations didn't. And we actually became, in the early stages of lockdown, one of the only organisations actually in contact with people. So we had a lot more contact, for instance, with probation officers.
Yes.
Weren't having any face-to-face contact with people. Phones are a very limited kind of tool, really, in terms of knowing what's going on, and particularly knowing what's going on in a house.
Yes.
Children and families, you can't.
Can I just add, because June's also mentioned women involved in people involved in the criminal justice system, and I didn't mention that because actually it's a key part of our work as well, and we weren't able to do prison visits during this time, which meant those women were even more isolated. So absolutely, those people need support too, and they have all the other issues that we've talked about.
June also mentioned, people leaving prison during this time who hadn't necessarily been part of the national news sharing debate about what life was like and how it had changed. Okay, so I'm just looking at see if we've got any other questions here to put to you. So would you like to just, we've got 5 minutes left. What do you think are the potential good things for clients that might have come out of the last period, if there are any? In terms of Maggie.
Transformational things that's happened, it's beginning to happen a little bit, but I think it's been accelerated during this period, is adult social care is now kind of recognising and listening to the needs of people we all work with who have complex needs, who traditionally they haven't seen as the population they work with. Until fairly recently, we would have had incredible difficulty getting any referrals that we made to adult social care, even talked about. They're just coming back. Whereas I think particularly city councils, housing options team and so on, who've been supporting the hotels, have been able to have a different conversation internally around adult social care, and that they need to be responding to and recognising the needs of what is not necessarily their traditional kind of client group.
Hannah, anything?
Not a lot of good, to be completely honest, but I think the fact that they know that we're there for them and we will continue to be. So, we went into this next lockdown and our women knew that we weren't just not going to be there at all. And that some things have continued to be open, so they can access some services, which is great. I hope that some of it's yet to come, the good stuff which they won't be seeing now, but the learning that I mentioned and the spotlight on the issues that affect vulnerable people will not go away and will be recognised, and some funding will go into that. And what Marcus Rashford's done is amazing in highlighting issues for children. And Maggie's right. I mean, I've got a friend who's a safeguarding teacher and is trying to safeguard by telephone via the people who may be the risk to the children and those kind of things,
Yes, and just an interesting observations coming here from John S. He's saying, the loss of face-to-face is a double whammy, not just for service users, but also for staff, because it means that they kind of are feeling the quality of what they're doing is reduced and their support is compromised, less job satisfaction. And of course, you know, the staff involved in delivering these services are quite obviously the key to success. So, okay, so thank you. I think we've just got a minute left now, so I think it's just appropriate to thank Maggie and Anna especially for both your presentations and for your responses during this session. And of course, from my perspective, for being fantastic members of the partnership board. You know, we've got 20 organisations on that board, and this is 2 of them. And I think, you know, it's very, very, very impressive, the resources and skills and insights and commitments that we're able to deploy through Golden Key on behalf of people with complex needs. So thank you both. Thank you for everyone who attended. We're going to keep doing these. We've got a plan to do some really interesting topics, so please watch out for them. I just want to end really by especially thanking Sarah Jane for fantastic organisation which has gone into this, and to Taylor Rickwood as well for her support today. And of course, we must end by thanking our friends at the National Lottery Community Fund for enabling Golden Key to actually get off the ground and continue. So thank you to everybody. I hope you have a great day. For those of you still wearing pajamas, it's time to take them off and get on with your day. And look forward to seeing you all soon. Bye-bye.
Yeah, thank you. Bye.